We're talking about hepatitis C, blood-borne virus that attacks the liver and can end in cirrhosis and liver cancer for some patients. The HPA estimate that we've got about 214,000 people infected in the UK, and that half of them don't know. Dave already said that about 90% of patients, although I would say 90% of new infections in the UK we know are now from drug use, which is why the Hep C Trust have been very glad to work with that action where we can meet a lot of potential patients. We also know there's very few in specialist care, so you know if you break your leg and you go and see a doctor, he sends you to a bone specialist. With Hep C, we send you to a Hep C specialist, or we definitely should be if you're diagnosed, and very few people make it. So we are testing people, but very few people make it to specialist care. And that is alongside with very large DNA rates at hospital appointments amongst service users, for example. Just to set the tone about how many people are in specialist care, this was some data produced by Matt Hickman and Natasha Martin. It's 2011 data, although I've not really seen a dramatic increase in the number. And just to break it down, I suppose, when we're talking about PWID, we're talking about people who inject drugs. And for example, Bristol Hospital treated 18 people who injected drugs for their Hep C in one entire year. Manchester, where we are today, 63, but they've got a much higher prevalence. And we've got like 17, 32. So we're not talking about huge numbers getting treatment for their Hep C. I've had this model done by Natasha Martin for Cornwall, and I went down there. They estimated 16 people who inject drugs treated in an entire year. When I went down to Cornwall, the main treating hospital said, yeah, that's about accurate, and this was in 2013. This graph, what it intends to show you is that what Natasha Martin and Matt Hickman have realised is that if you treat just a few more people for their Hep C, you can see a massive decline in the virus in our society. If you imagine, on one hand, you've got new cases, we're finding new diagnosed cases of Hep C, and on this hand, we're treating hardly any of them, which is what's happening at the moment. But when we start finding less and we start treating more, as soon as the scales tip just a little bit in a more favourable direction, you actually see a rapid decline of the virus. And we are talking about elimination today, and I think it's achievable over the next 20 maybe years. So we will start seeing that happening. What Natasha Martin and Matt Hickman have worked out for us is that 16 people who inject drugs, and there's 2,000 people who inject drugs in Cornwall. So that's 8 per 1,000 we're treating at the moment. That's this line here, if you can see it, up to 2027, not really having much effect on the amount of Hep C. However, what they've worked out is that to follow maybe this line here and to see a massive effect on the amount of Hep C, you would only need to treat 20 per 1,000, which would equate to 40 people who inject drugs in Cornwall each year up until approximately 2030 to have a massive effect. So the point of this is we don't need to treat everyone necessarily, we just need to definitely start treating more, and we'll have a massive impact on the amount of Hep C amongst service users. We've recently formed a partnership between Action, the Hep C Trust, and AbbVie Pharmaceutical Company. They've helped us to deliver staff training, peer education programs, buddying programs, more engagement at needle and syringe programs, and also community treatment. I'm going to talk about a few of these interventions quickly. The workforce development program, the idea being the staff in drug services are the first people that need to be trained. They need to be able to have confident discussions about Hep C with people. These are the sort of first people that service users come in contact with, and they need to be given information about risk and information about support and testing and stuff. We've been doing this for about 2 years. I've trained about 600 staff over the last 2 years at Action, and this is an evaluation that was done, the red being the level of knowledge before we went in and trained, and the blue being the level of knowledge after we've been in and trained. Although it was done at the end of the day, and as you know, like 2 or 3 weeks later this can get a little bit lost, but we're continually working with Action and providing training to the staff there. At the end of the training we did notice an increase in testing uptake within Action from approximately 13% to about 21%. I know these numbers sound low, but I've been told by my bosses they're not low. And in fact that's a pretty good rate of testing in the drug service in this day and age. The other programme that we're particularly fond of is called peer-to-peer education. This is where we have maybe a volunteer at a drug service who has had Hep C and maybe had Hep C treatment. We go and work with them on their personal story, and then they go out into the community and deliver their personal story for about 20 minutes. And we find this is a really good way of getting a message into the drug using community, which is what we want to do. We listen to their personal story. We make sure there's 5 key messages that we want in the community about keeping people safe and about getting tested if they're at risk. And then they go off to other organisations other than Action, rehabs, hostels, other institutions, and take like mini groups really and deliver their personal story. And we found that basically rather than a doctor, nurse, policeman, whoever telling them, you know, what about Hep C, this is coming from a person who's lived it, and we find that they respond really well to that.